Hi, good evening, everyone, and welcome to the COVID-19 Community Town Hall, which is presented by UP Health System Portage. We want to welcome all of our viewers and listeners that are tuning in tonight on the Zoom webinar, Facebook Live, social media, 97.7 The Wolf, and Q107 Radio. It's great to have you with us tonight. Our town hall topic will focus really on three areas tonight, including we'll provide some COVID-19 related updates, offer general health recommendations, and talk about other programs and services offered through our local and state health departments. So it should be a great session here tonight. I want to recognize our sponsors, which include UP Health System Portage, the Michigan Health Endowment Fund, and in addition, the Blue Cross Blue Shield Foundation of Michigan. We appreciate their support along with the support of the Health Research Institute. They organized the Town Hall series, and their mission is to support health-focused research, education and training, and outreach here in the rural Upper Peninsula. The goal of each town hall is to help increase our awareness about COVID-19 and how it impacts our health and society at large. And we're starting the transition from talking not only just about COVID-19, but other broader health issues for our Upper Peninsula region. Just want to remind everyone that all of our town halls are publicly available. They're recorded and archived on our Michigan Tech website. That website is mtu.edu/health-research. Once you're on the page, go ahead and click on Town Hall, and you can pull up any of our recordings. Tonight's recording will also be aired on ABC 10 coming up on Sunday, May 8th at 12 p.m. Eastern. Tonight, we have an excellent lineup of speakers. They'll not only provide information, but also have an opportunity to answer questions that you can send us here. Tonight is our 27th edition of the COVID-19 Town Hall series, and with that in mind, I want to turn it over to Kelly Camp, who's really been the anchor of the Town Hall series and the content expert. She's an epidemiologist by training, a member of the Health Research Institute, and a college professor here at Michigan Tech University. So Kelly, great to be working with you the last time, so to speak, for our final Town Hall. Can you tell us who's here tonight? And importantly, what are some of the things that we'll be covering here?
Absolutely. It's been a pleasure doing this whole series with you, and all the different panelists that we've had on has been really quite impressive. Tonight, as a little bit of a nod, National Public Health Week was the week of April 8th. So we have quite a few public health personnel represented here tonight. So we have from our own health department up here, the Western UP Health Department, we have Pete Berry, who's the Director of Community Planning and Emergency Preparedness. And the Emergency Preparedness Coordinator. And then we have Tanya Rule, who's also with the Western UP Health Department, and she is the Environmental Health Director. From our State Health Department, we have Heather Blankenship, who's the Bioinformatics and Sequencing Manager at the Bureau of Laboratories at the State Department of Health. And then, because it's always important to make sure that not only are we protecting the public's health, but our own health, we have Dr. Terry Kinzel here, who is an internal medicine physician and specializing in geriatrics from UP Health Systems Portage. So we welcome all of our panelists to speak tonight on our swan song, I guess, for this series.
Okay. Thanks, Kelly. And just want to let folks know if they do have questions, each speaker will have about 4 or 5 minutes. If there are questions, there are 2 ways to send us questions tonight. If you are on the Zoom webinar, you can use the Q&A or the question and answer button at the bottom to send us a question. If you're out there on social media or radio, you can email us a question at townhall2020@mtu.edu. That was townhall2020@mtu.edu. And we'll do our best to direct our questions and answer as many as we can in the next hour. So Kelly, we want to turn it back over to you to provide just a general pandemic update, where we are as far as cases and community transmission. So the platform's yours.
All right. Well, for the second month now, things are looking relatively good. Cases are going up across the nation, but they're going up pretty slowly. And we do think that that's somewhat related to the high vaccination rates we have, as well as with the Omicron surge, there's quite a few people got sick. And so hopefully there's some protection that is conferred from those infections. But it is going up a little bit. Daily deaths right now are going down across the nation, but hospitalizations are going up a little bit. So there's always a bit of a question whether some of those deaths may unfortunately follow those hospitalizations. As far as community levels, we are low across much of the United States, including across the Upper Peninsula here. In the Lower Peninsula, there's a little bit of an area with moderate levels in the community. And that is really it's the northeast section of the Lower Peninsula, and that is really looking at the capacity in the hospitals there. So there's the percentage of the beds that are taken up by COVID patients is what's driving that moderate level in those areas. One of the downsides we really haven't in our local area, we haven't seen a lot of increase in vaccinations. So we are still sitting at about 52% of our overall population here in Houghton County that is vaccinated. About half of those people who are fully vaccinated have gotten their boosters. So once again, we would remind people that one of the ways we can get out of this and really be protected as best we can is to get your vaccination. Don't rely on a previous infection to be protective. Even if you've had an infection, you do need to make sure that you get vaccinated and get boosted. One of the other things that just recently came out to highlight is that although we are getting a little bit back towards normal, we can't forget the impact that this has had. So COVID was again the third leading cause of death in 2021. So about 415,000 people had a direct cause of death of COVID. Another 45,000, it was an underlying cause of death. And that's compared to cancer and heart disease, heart disease is the #1 leading cause of death in the US, and cancer is the second leading cause of death. So the direct impacts on those deaths, as well as the impact on the family members who have lost someone to COVID.
Kelly, two quick questions for you. Can you elaborate and tell us a little bit more about vaccines available for kids, especially the youngest kids? And then there is a question here already about who's eligible for a second booster shot.
Sure. So I'll start with the second booster shot. So if fully vaccinated was 2 shots, and then fully vaccinated became 2 shots with a booster, and now there's eligibility for a second booster. To my knowledge, and please anybody of our panelists correct me if I'm wrong, that you're eligible for a second booster if you're at least age 50 and I believe 4 months since your first booster. If you are immune compromised or anywhere 12 and above immune compromised, speak to your doctor. There are additional recommendations for people who are immune compromised in terms of a booster. In terms of the children, so our 5 to 11, so 12 and up is the same recommendations as adults. The 5 to 11-year-olds, so they've been approved for and recommended for the original series. We don't have enough data. We're still collecting data to determine whether a booster would be necessary for those kids yet, but there's no recommendations at this time for that. The big question has again been the kids under 5. So parents of kids under 5 have really been struggling. They haven't had an opportunity to be able to vaccinate their kids. So Moderna, I believe, just put in to the FDA for looking at whether they can approve for older than 6 months, so 6 months to 5 years. I believe that has just been or will shortly be put in front of the FDA for review. And that will take a bit longer. They want to make sure that particularly for the kids, that there's no significant side effects, make sure that they're safe in those kids. So that is a little bit slower. I know a lot of those parents, I have a lot of friends who have kids in that age group and are anxiously awaiting when they'll be able to get their kids protected as well.
And then Kelly, can you just provide a few other reminders for folks if they need to get tested, isolation, quarantine? I know just about every town hall you're reminding us, so reminders never hurt.
Sure. So the guidance gets really kind of a little more nuanced at this point. So certainly if you're not feeling well, these at-home tests that are available are a great opportunity to be able to test yourself at home, get a quick response right away. There's a lot of things that can look like COVID, and as we're getting back into normal, all these other things that we get, it's good to know, get those tests done. There's quite a lot of our different medical providers, and Pete can speak to whether the testing at the health department, a lot of that's changing and in flux right now, but those at-home tests are really helpful to be able to know. So if you're feeling sick, take a test so you know what you have. If you do have COVID, stay home. isolate, and there's different recommendations. I don't want to go through all of them because there's so many different ones. You do need to stay home. Check either the Western UP Health Department, your local health department, or CDC has all the guidance for when you're allowed to be out of isolation. Notify people who you've been in close contact for those 2 days before you got sick up until the time that you started isolating, so that they know they've been exposed and can take precautions to quarantine if necessary. And again, those depend on what your vaccination status is. So check those websites or contact your local health department to find out exactly what you need to do. But you need to still take those precautions to protect yourself, protect those around you, and make sure that you're not spreading this on further. So making sure that you're taking all those precautions, including washing your hands, wearing a mask when necessary, absolutely get vaccinated and get boosted.
Great, Kelly. We're going to move on to our next speaker here. We're actually welcoming back Pete Berry, who is with the Western Upper Peninsula Health Department. He's the Director of Community Planning and Emergency Preparedness. So Pete, this is really fitting. Tonight's our last town hall, and you were on our first town hall back in the fall of 2020. And I believe this is either your third or fourth time on. So we really appreciate the updates that you've provided along the way. And we'll turn it over to you to tell us a little bit more about what's going on at the health department as we look ahead, hopefully turning the corner on the pandemic.
Sure. Well, first of all, I'd like to start by thanking, Steve, Kelly, and all those behind the scenes who pull these town halls together. This has been a fantastic venue for sharing and learning throughout the pandemic, and I know it's no small feat to put these together. So thank you. And thank you to Kelly for that view of the current situation. All great advice. You nailed it. We're going to have our ups and downs, right? But we've learned a tremendous amount about the virus and mitigation over the past 2 years, and a lot more tools in the toolbox than we've had previously, allowing us to kind of move on with some semblance of normalcy. So speaking of normalcy, right, for a local health department, this is something that we've been kind of grappling with, trying to figure out what normal is. We're a public health agency, not a pandemic response unit. And we've reestablished basically all of our previous programs. On the COVID front, we're in what you might call the recovery phase. We transition away from an emergency response footing towards more regular operations. This includes things like demobilizing special projects. For example, we have school liaisons who are working with us remotely from places like Georgia, South Carolina, Detroit. They were making, phone calls to school-age kids, working with the families just to kind of augment our existing staff. So we're kind of winding those programs down. Working on wrapping COVID into our normal communicable disease operations, kind of working through the development of an after action report and a lessons learned document. Those lessons learned are going to be many, and putting that together is a bit daunting, but it's something that we've got to work through and kind of pick at for the future, because we're gonna get a lot out of that document over time. So as we pivot away from the response and re-engage the broad scope of what we call normal, we've realized how fatigued and kind of battle weary a lot of our staff are, how ragged some of our programs have become. But in spite of this, we're kind of re-energized by that pivot, and we're ready to continue that mission. Quite literally, our mission at the health department, right, is to lead the community towards better health. And we do that through a whole lot of things: education, advocacy, disease prevention, and seriously, who can argue with better health, right? So we've been here since 1936, working on that mission. We've worked through the pandemic with the community, and we're going to be here for many years to come with that same goal. So how is it that we tackle that mission? A mission that's as broad as better health. It sounds like a very broad, generic term, but it's a battle we fight on many fronts. Most are probably familiar with our public health programs: immunizations, sexual health, WIC, maternal and infant health, communicable disease control. These are core programs that have kind of anchored local health departments for decades. And we have other long-standing programs such as health education. That's a field that's constantly evolving. That currently includes asthma education, classroom education on healthy eating, working with senior citizens on food safety, healthy choices, working with schools on healthy options at their concessions, promoting healthy choices with senior citizens, and working with grocery stores on healthy food promotions, and a whole variety of different things we're doing with that group. We also do a community health needs assessment where we kind of lead the process for understanding our communities better. This info is used by nonprofits, community organizations, and it helped kind of lead these healthcare entities to further their health goals and their programs in our area. When we first started doing that, we were kind of amazed by how often after we did the first few, we would hear that people say, oh, I pulled that needs assessment document out all the time. And that's something that we've carried on and continue to do and plan to continue to do for a long time. We have new programs. We've got some adverse childhood events programming, toxic stress reduction for children. We have a syringe service program, part of a larger harm reduction initiative, peer recovery counseling for substance use disorder. We have a new laboratory brought on by COVID, basically enhances local capabilities in a state-of-the-art facility. We can do high volume COVID testing. We'll be bringing on influenza and RSV soon. The drug court is utilizing our services for their drug testing and a host of other concepts that are in the works. So we're excited about that addition. It's a regional laboratory kind of brought into our facility over the last couple of years. Emergency preparedness and response. We have this all hazards approach where we work with local response partners and engage emergencies. Public health issues in an emergency situation it's the disaster after the disaster. So flood, fire, hazmat situation, there's always this secondary long-lasting role that continues long after the dust settles. So to kind of close, I'm a bona fide public health nerd, right? I could go on for hours about this, but I want to leave you with, kind of one closing thought. Your local health department, here and across the country, it's your resource. We're here day in and day out working toward health and safety improvements and access for all. We look forward to the future no matter what it holds. And we're always here ready to serve your community. And we're always looking for ways to better engage. So we appreciate this opportunity to come and talk today and look forward to what the future brings. So thank you.
Great. Thanks, Pete. We have two questions for you, one specific and I think one more broad and general question. There was a question that came in from a community member that if they do have a positive COVID-19 test at home, for example, do they need to report that to the local health department?
No, if you have an at-home test and it's not something you need to call us and tell us, it's not going to get onto any reporting documents. There's no reporting requirements through the state. There's really nowhere for us to put that information. But we do encourage people, especially if you're in a high risk group, to reach out to their provider and talk to them. There may be treatment, there may be things that your physician or your medical provider would want to talk to you about. So we would encourage folks, especially in those high risk groups, to talk to their provider if they do positive. But it's not necessary to contact the health department.
Thanks for clarifying, Pete. And then the final question, again, more of a general question here. You've been on the town hall a few times now. First one, the last one. What's the major lesson you've learned during the past 2 years?
That's a big question. We could probably go on and on, have an entire town hall of just Pete rambling. But I think the lesson learned is to really pay attention. For a local health department. I'm not talking about the community, but for a local health department, the biggest lesson learned is to pay attention to what's going on in your community and not get wrapped up in what's going on perhaps at the CDC level or even the state level in Lansing, and really focus on what's happening here in the Western Upper Peninsula. And I think the way some of the things rolled out and some of the things worked through the pandemic put us at kind of a disadvantage, and we lost our ability to really focus on our community because the information was not always coming from the community to the community. So it was a difficult road to hold, and the biggest lesson learned, at least top of mind right now, is that communication, the back and forth with our own community.
Well, Pete, thank you for the information that you provided to the community, and thanks for coming on the past couple of years to work with us on the town hall. We really appreciate it. We know you have to go to your next commitment, so thanks again, and just want to welcome in any new listeners or viewers that might be tuning in. If you're out there on 97.7 The Wolf or Q107, we're here for the COVID-19 Community Town Hall. We have a all-star lineup of speakers here tonight, along with Kelly Cam, our epidemiologist and anchor of the town hall platform. We're talking and providing some updates on COVID-19, going to be offering some general health recommendations and highlighting some other programs and services our local and state public health departments offer. So with that, I want to welcome in our next speaker for tonight. We have Dr. Terry Kinsel, who is a physician in internal medicine, working with older adults. So Dr. Kinsel's with UP Health System Portage. Thanks for coming on. And we're going to turn it over to you to talk a little bit more about some general health recommendations that you have for our community members.
Thank you. I'm glad to be here. So as you said, my training is in internal medicine and geriatrics. And when I was first in geriatrics, I was identified as a geriatric physician, although I was only 30 back then. And so I had to explain that being a geriatric physician meant that I was a doctor who was interested in healthcare of older adults. Now I can say I'm a geriatric physician and be true in both senses, that I'm an older adult also. My practice is quite conventional, although as I spend almost all my time with older adults, I have to pay attention to some things that are not as quite as exciting in acute care. And so I'm a little bit out of the mainstream there. So what I wanted to talk about is what are we supposed to do with our general health now that we're beginning to unlock and open up? The first thing I would say is for any of you who have chronic conditions like hypertension or diabetes, heart disease, who may have, kind of been putting off taking care of your senior doctor and taking care of your stuff. I would say, now is the time to get back and really get tuned up, because in the long run, taking care of those, and there are things that we can do that can make a big difference. So make sure you don't skimp on that. Following that, it's also might be time to look at your preventive services. And I don't think I'm going to talk about this at this point, but many screenings are recommended. For instance, your colonoscopy. You might say, well, I'll just do one more year, or DEXA scan or mammogram. Check those out again. And if we have time, we'll talk about more. The other thing, in general, is that I would make sure that it's time to make sure your vaccines are all up to date. In particular, you think of things like tetanus, flu, pneumovax, Shingrix, and the COVID. The tetanus, it only has to be over 10 years, but lockjaw is an awful way to die, and it's such an easy way to prevent it. The flu, I kind of, so some flu kills people my age, but it rarely kills middle-aged people. But I would say, even if you're middle-aged, I would encourage you to get that, not so much for yourself, but for your loved ones and for the rest of the community. Because if you have the flu, you're infectious and you can give to other people. So even though you're just going to feel lousy for a week or two and probably not die, I think you have a responsibility to take care of the rest of us. And same thing with COVID. If you haven't been vaccinated and boosted, you really need to do it, because we're all dependent on all of us being protected. Now, having said that, I want to talk a little bit about staying well and living well. And this stuff is really just up to you. You don't need any pill pushers to make you healthy. You do it yourself. And the very first thing is to stop bad things. Don't, if you're in a hole, stop digging. And first, of course, is by far is smoke. Stop smoking if you can. Get help if you need it. But I would also say the other addictive things you have to be kind of careful with, alcohol and other drugs. There's no proof that people who abstain from alcohol live longer than people who drink one a day. But stopping at that one is hard. So I would look at those things carefully. The second thing, and this is, if I could put this in a bottle, I'd be really rich, but exercise. There's nothing in your health that exercise doesn't help. I mean, it helps your brain. People who exercise regularly have less dementia. It helps your heart. It's just everything. The goal is, and particularly again, I'm thinking mostly of my older folks, but is to start low and go slow. So, you may have been a college football star, but if you're 50 now and maybe 50 pounds overweight and haven't, lifted anything besides a can of beer in front of the sofa, in front of the TV, you don't start off doing what you did before, and the goal is to be at least 30 minutes, 5 times a week. And walking is a perfect way to start. It's a good weight bearing exercise, and almost, anybody who hasn't been severely injured can do it. Above that is certainly ideal, but at least at the very minimum, your life will be better if you do that. 3 kinds of exercise: aerobic, so that would be like walking, bicycling, swimming; resistance. So you think of Arnold Schwarzenegger and the big muscles, but you don't need that. But resistance, particularly as you get older, is important because it helps with your balance, helps you from decreasing falls and injuries. And you can do body weight resistance. So like even just getting up out of a chair is sort of a resistance exercise. You're working your quads a little bit there, but body weight squats, push-ups, pull-ups, those are all things you don't need a fancy gym for. You can do in your own home. And then balance exercises. And that you may need a little help with, but yoga, Tai Chi, something like that. Okay, the third thing that I would talk about is regain your center. And what I mean by that is that, it's so easy. I mean, I've almost stopped looking at the news because I always get all so worked up that if you can spend 10 minutes a day doing something where your mind is not focused on work, is not focused on kids, is not focused on anything, but the classic one is meditation. But one of the things that they in Sweden, they call it forest bathing, where you go out and walk in the woods, and there's evidence that this is good for you overall. Fourth thing would be nutrition, and I want to, there's 10,000 diets and maybe 5,000 people who've gotten rich off of the diets. The best overall is what I'll take from Michael Pollan, who's a writer of diverse things, but he summed it up into 3 recommendations. Eat real food, not too much, mostly plants. And what he means by that is, take those things that are mostly salt and sugar and plastic in the center of the grocery store and forget those. Go around the outside and find real food, food that your grandmother would recognize as food. 2, not too much. Again, you want to try to maintain your ideal body weight, BMI. What is BMI? Basal, no. I've forgotten that already. Anyway. Oh, body mass index. That's right. Thank you. That was my wife. And then finally, mostly plants. You don't. There's not overwhelming evidence that completely vegetarian is. Am I taking too much time? Yeah, I'll be is all much better, but not too much meat. And then finally, I would say avoid polypharmacy. When I walk onto a ward and I see a person on 12 medications, I tell them, you can stop 6, and I don't care what 6 you stop, you'll be better. But it's real easy to creep up in the medications. And so make sure that you say, do I really need this? And don't always go to the doctor to fix it. And that's it, I guess.
Great. Thank you, Dr. Kinzel. We really appreciate the recommendations. A few questions. I'm going to start and lead with a question. Kelly, I'm just going to ask you to help me double check the Q&A button to make sure we're getting all the questions from community members. Thinking about older adults who live alone, what can we do as friends, neighbors, community members to help support their health needs, just kind of in general? And then the second part of that, Dr. Kinzel, is sometimes adults, especially older adults, might be hesitant to share with their family that they're encountering some health challenges, their health needs. So how can we just really offer the best support and encouragement for them to potentially go see you or your colleagues if they need help?
And that's, of course, is a very, very difficult question. What I would say is to make sure they know that you're available when, and this is hard, but if they come and ask you for something, say, okay, we can't say, well, oh no, I was going to go out down have a beer at the bar tonight, but be there for them. With the children, it's really also a kind of two-edged sword, because we tend to discount older people as people. And so like it's really common when I have an old person and their child come in with the office, that I'll and I'm pretty good at focusing on the person, in question, but the child answers for them, and so you don't want to be overwhelming. The other thing is a fear of many people ending up in a nursing home. And so if they tell their children this, they're going to end up in nursing home. So be as supportive as you can. There are lots of resources available that will help people stay in their home. But social isolation is devastating. And I, I have my practice is almost entirely nursing home now, not quite, but almost. And during the worst of the lockdown, I had at least 2 patients that I'm absolutely sure died from isolation. That they just wasted away. So the more engaged you can be, well, I'll stop there.
And just checking in, Kelly, did we have a vaccine related question for Dr. Kinzel, do you think, in the chat?
Yeah, I think so, particularly with your high-risk patients. So an individual has asked that they're fully vaccinated in boosters. Does it really even matter if they catch COVID? So particularly from our high-risk older adults, what's the risk to them if they are vaccinated and boosted?
I mean, it matters dramatically. And I don't have the numbers on the tip of my tongue, but it's true. Even though you've been fully vaccinated, you can still catch it. But in the number of people that die, the number of people that have to be hospitalized, my recollection is only about 1/10 of the amount of people who have not been vaccinated at all. I can say at one of the facilities where I work, at the very first onslaught we had, which was back in October or November of 2020, that we had probably 40 patients, almost half of which ended up in the hospital, almost half of them died. Then we had another outbreak this September, October, and again, we had about 30 patients, but only one had to go to the hospital and nobody died. And it was just a dramatic difference because of the vaccination. Yeah, these were all vaccinated patients.
Thank you, Dr. Kinzel. For the sake of time, we're going to move on, and we'll have time a little bit more for questions at the end. We're about halfway through our COVID-19 Community Town Hall tonight, which is presented by UP Health System Portage. I want to take a second here and recognize our supporting sponsors, which include the Michigan Health Endowment Fund and the Blue Cross Blue Shield Foundation of Michigan. We appreciate their support. We have our panel of experts here tonight providing, we just heard from Dr. Terry Kinzel, offering some general health recommendations, especially for our older community members. We heard from Pete Berry from the Western Upper Peninsula Health Department. And that leads into our next speaker tonight. We're going to welcome in Tanya Rule. It's a pleasure to have her join us. She's also from the Western UP Health Department, and she serves as the Environmental Health Director. So Tanya, welcome to the Town Hall, and tell us a little bit more about some of the programs and services that you spearhead here at our local health department.
Sure, I appreciate you guys having me tonight and having the opportunity to talk about some programs that I'm passionate about, that now that we're transitioning from the pandemic response, moving through the recovery phase, it feels a little bit like we're getting into some normalcy, and we're beginning to focus back on our core environmental health programs. Like you mentioned, I oversee the Environmental Health Division. So primarily, we focus on the environment around humans and how the environment affects human health. So we do a lot of environmental health and safety inspections. I'll refer to our 3 core programs, the on-site water supply and on-site septic system programs. We evaluate private property and regulate construction of septic system and water wells to ensure not only safe drinking water, but to protect our resources, to ensure that our groundwater supplies aren't becoming contaminated, and also our surface water supplies like our inland and Great Lakes, that they're not becoming contaminated through unauthorized or illicit discharges of wastewater. Last year was a stellar year. It seems like there's a lot of people wanting to move to our area and build. And we saw over a 60% increase in the number of properties that we evaluated for on-site septic system last year. And then our other core program is our food safety inspection program. So we regulate around 400 food service establishments in our 5-county district. They get health and safety inspections every 6 months. We focus on food safety and the risk factors that can cause foodborne illness to occur. And then we also do foodborne illness response, and we do a lot of food safety educational training sessions with our food service operators. And then we have a lot of other like little, we call them mini programs, health and safety inspections at campgrounds, public swimming pools, tattoo and body art facilities, beaches, medical waste generating facilities, septic waste disposal, and then daycares. Tonight, I really wanted to just focus on a few programs that I'd like to highlight that we're going to be moving into over the summer. We seek and obtain a lot of grant funding to do some really good public health service programs that we wouldn't normally have either local or state funding to do. The first program I want to just briefly talk about is PFAS program. We are participating in some drinking water sampling for PFAS. If you're not familiar with what that is, it's a man-made component that's been readily used in manufacturing industry and our local airports. So we have Houghton County Airport and the Gogebic County Airport. For the past, couple decades, they've been required by the FAA to use a very specific brand of fighting foam to practice training exercises, and the state identified that foam is a cancer-causing agent. So there's concern that some of our local drinking water wells may have been contaminated because that foam was discharged to the runway on an annual basis for training exercises. So we did do some robust sampling along with the state around both of our airports. So far, we've seen no impacts of water wells near the Houghton Airport, but we do have groundwater and water well contamination in some of the wells in the Gogebic Airport area. So we are working, ensuring that those homeowners get bottled drinking water. And then through the grant program, we've been paying for filter systems to be installed at those residents so that we know that they're not going to have any continuing health implications from drinking the water. And then moving on to our bathing beach program, we get a lot of grant funding to sample for E. coli at our inland and Great Lakes beaches. We have in our building, we've done some renovation on an existing laboratory. We conduct a culture-based method for beaches. We sample daily, we get results the next day, most probable number of E. coli in the water, and then we advise the public to swim there or not. The downfall of that method is that 24-hour response time. So by the time we get results, the people who were swimming there have already been in the risk factor. So we did get funding to purchase equipment for a qPCR laboratory. So that's a rapid method that allows us to get sample results within hours. So we did work with a local laboratory called Whitewater Associates, and they house and operate our equipment. So we do duplicate testing, and we can get rapid test results. We can do same-day beach management decisions and actually close the beaches when they're unsafe for swimming. And then with that technology, we can also do source water tracking. So we can compare specific DNA to specimens of like human specimens of like geese and waterfowl or beaver. We can figure out where the wastewater contamination is coming from, and then work with the local beach operators to mitigate those point and non-point sources of contamination affecting the beaches. Next year, we're hoping to expand and put in another qPCR beach lab and double our number of beaches. We're hoping to go from 25 up to 50 beaches because we do cover such a large 5-county area. And then to end, I just want to let everyone know that we do continue wastewater sampling on a weekly basis. We sample 29 sewer locations in our 5 counties for COVID wastewater surveillance. So we are sampling the wastewater. We work with our local utility companies to do that sampling. Houghton, Michigan is one of the 20 Sentinel locations in the state of Michigan. So our community is used as a statewide monitoring location. Good news is the wastewater has been relatively low, going along with our case count. We do use this as a factor. We can identify COVID in the community before we even see cases in the clinical sense. So people begin shedding COVID in the wastewater before they get sick enough to maybe get tested or go to the doctor. So the last 15-day trend for the Houghton Sentinel site has been trending pretty level, but there was a slight increase in this last week, but still looking pretty good.
Tanya, first question here for you. And again, we'll check in with Kelly here in a few minutes. Where can folks go to just get information on many of the programs and resources, services that you mentioned? And then specifically, there was a question here about the beach monitoring or some of the results from the water testing. Where do they find that? Is it website, in person? Can you just tell us more?
Sure, absolutely. So all of our environmental health programs are all full public access. Every record in my department is open to the public for viewing. You know, if you don't have the technology to go online, you're welcome to call us and ask questions. You can fill out a Freedom of Information Act request if you want to get copies of anything. But as far as like finding more information, our website is a great resource, Western Upper Peninsula Health Department.org, or just the initials WPHD.org. And through our website, you can link to the state. It's the website for the beach sampling results is called BeachGuard. So if you do michigan.gov/BeachGuard, or you can link directly through our website, we put all the beach sampling results on there every day. And throughout the state of Michigan, you can go on there and look to see the status of all the beaches. So that gets updated every day, which beaches are open, closed, or under a swimming advisory.
I'm going to check in with Kelly. Kelly, I know there was a question from a student here about careers in public health that might be appropriate for Tanya. You want to go ahead and ask that question?
Sure. So we have a minor in public health here at Michigan Tech, and I know that there's been record numbers of students applying for public health school as well as medical school, kind of in response to this pandemic. But I come from the epidemiologist side, and the programs that you have in the environmental health are so varied. What kind of a background do people need to be able to work in some of the programs that you work in?
Sure, that's a great question. There's a few colleges in Michigan that do offer an actual Bachelor of Science degree in environmental health. So that would be like a primary degree that we would look for. But otherwise, you would look for a degree in biology, environmental engineering, geology, or even environmental science. Any degree that allows you to have sufficient course numbers where you could sit for the registered environmental health examination, because our staff are required to hold that state licensure.
Thank you, Tanya. We're going to move on just to keep us on track here and welcome in our next speaker. It's my pleasure to introduce Heather Blankenship. Heather has a long title here, so bear with me. She is a PhD trained epidemiologist and is the Bioinformatics and Sequence Manager at the Michigan Department of Health and Human Services Bureau of Laboratories. I hope I got that right, Heather. Heather is going to be telling us a little bit more, providing perspective from the state level. And then also, I know there's a really exciting project that Michigan Tech University is partnering with the state health department. She'll tell us more. So Heather, welcome here, and we'll turn it over to you.
Thank you. And you did get that right. It is a very long title that essentially boils down to my everyday job is doing oversight of looking at the genetic material of pathogens across the state and how they impact their community. So really, over the past 2 years of the viral pandemic, we've been looking at things from a different angle. So while we have our clinical laboratorians, we have our local health departments, our epidemiologists, our state laboratory, all boots on the ground doing testing, identifying which people are positive for COVID. Do we need to quarantine, contact tracing, all of those things. We've also been doing another type of surveillance method in the background where we're looking at the genetic material of SARS-CoV-2. And we're doing this for a wide range of pathogens in Michigan. It's not just for COVID. We're doing for things like foodborne outbreaks. So looking to see if we have outbreaks and we see recalls in the grocery store for things like leafy greens and lettuce causing illness. It's part of my group's job that we go in and we look to see what specific bacteria does it match. Going down all the way to the DNA, does the DNA match another organism from a specific farm, from a specific package of food? Does it match other people within Michigan that we can identify maybe where it's coming from? So with SARS-CoV-2, we started doing this very early on in the pandemic. It was within 10 days of that first positive that we had. So it's been over 2 years now that we've been doing sequencing. And very early on, we wanted to know what even is this virus. So sequencing it gave us that clue. It gave us that inside look to the virus. We knew it was causing infections. We knew it was causing certain symptoms and illness. And we could look at those epidemiological transmissions based on people that were interacting with people and the positive case counts, but what was actually going on with this virus and how could we contribute to it? So we wanted to learn and help contribute to what's even going on with this. What does this virus look like? And very early on of when vaccine development was still occurring, having that genetic material meant that vaccine development could target areas that were not going to rapidly evolve, so that we did not have to have this constant changing of vaccines as we had new mutations arise. Over the past 2 years, it's kind of changed as we've learned more about the virus and as we've learned what that genetic material can tell us. It's changed, and I'm sure all of you guys have heard over the past year and a half of variants that have come out and of concern. And that's not to say that there haven't been variants since that very first sequence that we did, because viruses evolve. They have mutations, they add mutations. Some of them give it a benefit and it can transmit more, which we've seen with some of these variants of concern that we're more concerned about, that they rapidly spread through the population a little bit quicker. Other mutations don't change the virus at all. They occur, we see them only because we're sequencing and we're getting down and looking at that genetic material very, very small, but there's no change to it. And that's what we've been seeing all along. It's only these ones that have some sort of change. It's going to change how we might need to respond. It's going to change possibly maybe whether monoclonal antibodies are going to work for a specific variant. It's going to change potentially how the transmission of it. Does it transmit better or worse? Gives us a clue into what's going on with the virus. So we have been doing this across the state. We have been getting clinical samples from clinical partners, self-state, any samples that are sent to the state laboratory, we are sequencing. But one of the things that COVID really kickstarted for us is realizing that we all knew how big the state of Michigan was, even for myself, compared to getting up to where Michigan Tech is. It's a 9-hour drive. So it takes time to get those samples here. And the process of sequencing itself is another 5-6 days, making sure that we're capturing everything that's going on within a community, which really led to us starting the program that the state laboratory is now partnered with 4 other academic partners, including Michigan Tech, which is called our My Sapphire program. So it's Michigan Sequencing and Academic Partnerships for Public Health, Innovation, and Response. So this was really started so that we could start figuring out how can we get information that's occurring in some of these communities that may be underrepresented. How are we going to capture these rural communities, or how are we going to capture areas of Michigan that we just don't see the numbers, and may give us an indication of what's going on in those communities and include and make sure that we're not missing out on anything that's going on. So that is one of the things that Michigan Tech's campus, working with Western UP Health Department, will be doing some of their own sequencing of COVID and other pathogens that they bring on in conjunction with state lab, and starting to figure out how can we really start to build those partnerships between state public health, academic partners, and local health departments to really strengthen everything that we can learn from the virus, going all the way down to the genetic material, looking to see how that can help us with how we see these pathogens transmit through the environment and from person to person, and really what is going on with some of these pathogens that we didn't have insight into in some of these areas. So that's going to be a very quick of some of the stuff that we've been doing for sequencing over the past 2 years, of looking at this virus going all the way down to its genetic materials, and some of the ways that we are growing in partnerships that are developing between the state, the local health department, as well as Michigan Tech University.
Wow, thank you, Heather. That was a great overview. Really appreciate that and excited about the partnerships that you described. Where we are right now, can you tell us more about the anticipation of new variants, and if we will get to a point where, similar to flu, where we might be able to sort of anticipate or predict a seasonal strain? I know there's a couple of questions that came in about that.
Yeah, so it's something that we're going to continue to see variants. It's inevitable. The virus is going to continue to have mutations. We're going to continue to see them pop up. The Omicron variant that we have circulating now, it would not surprise me if in a couple of months we have another variant of the Omicron variant has accumulated more mutations, and now it has changed the virus just enough that it has some sort of change, whether it's transmitting less, more, whether it's doing something different in the environment. It would not surprise me at all. It is something that a lot of academic researchers are currently working on, of how do we use some of the modeling and statistical models and some of the mutations that may occur to start predicting. Can we predict where in the virus we're going to continue to see these mutations occur? Can we predict what different outcomes might be of it, how it might change the virus, how it might interact in a host body based off some of these mutations? So there is a lot of research ongoing and continue to ongo of some of these models. We've seen it continue to occur of there's specific portions in the virus that just tend to accumulate more mutations than others. But I think that's still a lot of research that's occurring with something that is still very novel in the field.
And Heather, a follow-up question here. This has come in a few times as well. The difference, or could you clarify, pandemic versus endemic, and where are we on that front?
Yeah, so endemic is going to be once we get to that state that it is pretty much here. It is going to be like every other cold coronavirus that is an endemic state. It is just in our community, and it's something that we are going to continue to be exposed to. I think we are still kind of hoping that we are going to go in that recovery phase and continue to stay in that recovery phase that has been laid out, and that we're not going to have to switch back to that response phase. But I think that's still part of the hard part with this virus, is still not fully knowing exactly what's going to happen even 2 years into the pandemic.
We do have time for a few more questions. So if you would like to email us at townhall2020@mtu.edu, or you can use the Q&A button at the bottom if you're here on Zoom. This question is for Dr. Terry Kinzel. Dr. Kinzel is the physician on the panel from UP Health System Portage. Dr. Kinzel, you talked about that special pill, if you could put in a bottle, called exercise, and many of the health benefits. I'm just wondering if that's something that patients, when they come in to see you in the clinic, or you're in the nursing home and checking in, is that something that's being asked, if people are active, and if so, how much? And if not, how can we sort of do a better job at that, given how you express and describe the benefits of that sort of magic pill?
I think that it's very commonly being asked these days, and particularly in nursing homes, we have people that are, we have a full staff of occupational physical therapists who, get people started on an exercise program, and then the nursing staff take over. One of the practices that many physicians are doing are actually writing out prescriptions for exercise. So instead of writing out a prescription for Prozac, I write out, 30 minutes of walking 5 times a week.
That's excellent, and that's a prescription I think will really benefit a lot of individuals. That's something near and dear to my heart, so I appreciate you elaborating a little bit on that. Next, I wanted to turn it back over to Kelly. Kelly, can you maybe kick it off here about sort of increasing awareness about public health in the month of April, and maybe Tanya and Heather can follow up about this time of year in the spring.
Sure. So I think Pete said it best with the health departments, and at our state, our local, and our federal level are much more than just a response to an outbreak. That tends to get, even before this pandemic, the disease detectives kind of get all the glory because they're out there and recognized, but all of these programs and and people working to keep us healthy and safe. And I think a lot of it, from a public health perspective, it's all the prevention. It's all those things that you don't notice are happening until they stop working. And so that you don't know what's going to happen if it wasn't there, but that's what prevention is. And so all of the work that our health departments have been doing, not only during this pandemic, but to maintain all of those other programs during this, I think that's something that really needs to be commended. And I don't think they've gotten the recognition of what they have. We have Rural Public Health Day and Rural Public Health Week back in November, and National Public Health Week in April, but it tends to be those of us in public health know about it and kind of go, hey, happy Public Health Day, to each other. So I just want to make sure to thank everybody and bring that recognition forward. I did have a question for Tanya, because we've done the wastewater testing here at Michigan Tech as well, and used it when we saw rises last year in some of the flows. We did use that to target some of our testing, but I know it can be used for a variety of other pathogens. And Heather mentioned that in terms of, some of these other pathogens that we want to keep testing for some of the genomics. Is there any thought to whether we continue doing some of this sewage testing and wastewater testing for other pathogens here in our area?
Yes, absolutely. We are partnering with DHHS, and we filled out a survey recently identifying some pathogen targets that we would like to do in our community. We could use the technology not only, like you said, for doing the SARS-CoV virus, but for E. coli in our waste, our surface water streams. We were talking about doing some surveillance for norovirus in our community. We could use it for drug surveillance in communities that have a higher incident rate of drug usage. There's many different things that we could use that technology for. And the goal moving forward is to keep the technology here, because if we don't use it, we have a memo of understanding with the state that if we're not going to maintain it and use it for public health services and public health surveillance activity, that it would then get routed to another community who could use it. So our goal is to keep it in use, absolutely.
Really quickly, we're going to give each speaker here just 10 to 15 seconds. If you could just give us a rapid fire take-home message from your part. Maybe we'll go in reverse order and start with Heather.
Yeah, I think Kelly said it best, that public health is not just a response. And for myself, genomic sequencing is always occurring so that we can help to detect those responses before it becomes a need for that large-scale response.
Thank you so much, Heather. Let's go to Tanya next.
I think our goal for the future is really focusing on public health education in our community and educating them on the programs that we do and building that rapport and trust back in our community. Because I think Pete touched on that. We lost a lot of local control and we had to rely on what the state and the CDC was telling us. And I think just listening to our community and rebuilding trust is our path moving forward.
Okay, Dr. Kinsel.
I think mostly I would say is that there's so much you can do for your own health. You can partner with a provider, but you need to do it and not expect the pill to fix everything.
Great. I want to thank all of our speakers, not only tonight, but we've had over 100 people come on the town hall. Tonight was our 27th and our final edition. As always, Kelly, it's a pleasure to work with you. We appreciate the support of all of our sponsors, including UP Health System Portage, the Michigan Health Endowment Fund, and the Blue Cross Blue Shield Foundation of Michigan. Thank you to all the community members for doing your part to stay informed, keep up to date, and follow the recommendations from here, our experts that are right in the community right next door. We'll leave you with this. We'll be taking a break over the summer, and we're optimistic and hopeful that we'll be able to continue the series in the fall and focus on broader health issues for the community and hopefully not provide too many more COVID-19 pandemic updates. We'll be looking better. So thanks again, everybody. Have a great evening, and we'll see you out and around the community. Bye-bye.